valent HPV vaccine against infection and intraepithelial neoplasia in women. By Gada Romanos. Definition. The human papillomavirus HPV causes premalignant and malignant lesion of the cervix, vagina, vulva, anus, penis, and oropharynx, as well as genital warts. The recent development of prophylactic vaccines directed against the most relevant disease-causing HPV types has helped to prevent diseases related to HPV. Current HPV vaccines address approximately 70% of cervical cancers through protections from HPV-16 and HPV-18. Partial cross-protection against non-vaccine HPV types has been reported for both licensing vaccines, although the clinical significance of the partial cross-protection remains uncertain. The investigational 9-valent HPV virus-like particle 9V HPV vaccine addresses the 4 HPV types 6, 11, 16, 18 that are in the quadrivalent HPV vaccine plus 5 additional oncogenic types 31, 33, 45, 52, and 58. The 9V HPV vaccine offers the potential to increase overall prevention of cervical cancer from approximately 70% to approximately 9%.
The new human papillomavirus vaccine is making waves in the medical community for its ability to protect against even more HPV strains. Here's what you need to know about the vaccine. The Food and Drug Administration, which approved the new vaccine Gardasil 9 this week, says it has the potential to prevent around 90% of cervical, vulvar, vaginal, and anal cancers. The current Gardasil vaccine prevents around 70%. Gardasil 9 protects against 9 strains of HPV, 5 of which can cause cancer and 2 of which can cause warts. The original Gardasil vaccine protects against 5 strains, and the only other HPV vaccine, Cervarix, protects against 2. Gardasil 9 is not yet on the market, and it's unclear when it will be. It still needs to be mass manufactured, and insurance companies need to decide if they will cover it or not. Until then, doctors are still recommending patients get the current vaccines. It is also not clear at this time if those who have been vaccinated with traditional Gardasil or Cervarix can be revaccinated with Gardasil 9 to get the additional protection when it becomes available. Gardasil 9 will be administered in 3 doses over several months, just like the current HPV vaccines. The vaccine is recommended to girls 9 to 26 and boys 9 to 15, preferably before they are sexually active. The FDA says the effects of Gardasil 9 are minimal. The most common are injection site pain, swelling, redness, and headaches. The Centers for Disease Control and Prevention released a report this summer saying far too few Americans are receiving HPV vaccinations. In Americans aged 13 to 17, only 57% of girls and 35% of boys received at least 1 dose. That's opposed to the around 80% vaccine coverage in other industrialized nations. The CDC lists lack of knowledge, safety concerns, and the belief the vaccine is not needed as factors as to why many American parents choose not to vaccinate their children against HPV. For Newsy, I'm Madison Burke.
Applications in medicine. In clinical trials, the valent HPV virus-like particle vaccine against HPV type 16 and 18 was efficacious against related infection with these types and against cervical dysplasia, and the quadrivalent HPV virus-like particle vaccine against type 6, 11, 16, 18 was efficacious against related infection and against cervical, vaginal, vulvar, and anal dysplasia and against condyloma related to HPV-6 and 11, 13, and 17. Post-licensure reports from countries with established HPV vaccination programs indicates that HPV vaccination has a beneficial effect at the population level as early as 3 years after the introduction of an HPV vaccination program, including decreases in the incidence of high-grade cervical abnormalities 18 to 21, the prevalence of vaccine of HPV types, and the incidence of the genital warts. Analysis of clinical trial and post-licensure safety data have not identified safety concerns associated with HPV vaccination. To illustrate more this problem or this concern, we have a video. So, we will, we will present the pros and cons of this non-valent HPV vaccine. first pro we have is that the primary efficacy hypothesis was that as compared with the Q quadrivalent HPV vaccine, the 9V HPV vaccine will reduce the combined incidence of several conditions related to HPV 31, 33, 45, 52, and 58 in women from 16 to 26 years of age who were seronegative on day 1 and for whom there were negative results on PCR assays for the relevant HPV type from day 1 through month 7. In the per-protocol efficacy population, the incidence rate of high-grade disease related to HPV 31, 33, 45, 52, and 58 was 0.1 per 1,000 person-years in the 9V HPV group that than 1.6 per 1,000 person-years in the Q-HPV group. The first count is thus: it was determined that a direct comparison of the two vaccines on the basis of disease endpoints related to HPV 6, 11, 16, and 18 will be prohibited in terms of study size. In contrast, the incidences of high-grade cervical, vulvar, and vaginal disease in the Q-HPV group continued to increase over time.
Welcome to AFD TV. I'm Dr. Sam here with Ashley, our medical director of our new AFD Wellness Clinics. Thanks for being here, Ashley.
Thanks for having me again.
Today we will be discussing Gardasil. Should we vaccinate our kids? Which now the recommendations include both boys and girls.
So that's a great question, and you can argue for it either way. So you can argue for it in that it does protect against cervical cancer and warts, and the Gardasil vaccine is somewhat expensive, but you could also make the argument that treating cervical cancer is a lot more expensive. So how do you feel about it?
That's a great question. Well, it is a relatively newer vaccine. It's not something that's been out there forever like the flu vaccine or pneumonia vaccine. Anytime there's anything new, I definitely encourage parents and patients to go in with their eyes open, to Google from ideally reputable sources, print out any information or questions you have, and when you see the doctor, ask them for their thoughts and opinion. There obviously have been cases in the literature where patients have gotten Gardasil vaccine and have had possible side effects to it, but right now they can't link it to the vaccine. It could have just been coincidence, but nonetheless, as a parent, it does concern us if there is any potential risk. The good news for cervical cancer with HPV testing is that it is actually on its way down, which is good. Genital warts, on the other hand, is not. So that is actually a big benefit for Gardasil vaccine for both boys and girls. One of the big questions is, why do we have to vaccinate our kids when they're 11? Can't we wait till they're older? Well, honestly, my take on that is when kids are 11 or 12, they're more likely to be going to their pediatrician, and pediatricians tend to be the best at vaccinating. If we wait till they're older, it's less likely that they will get their vaccinations. So there is no right or wrong as far as number one is going in with your eyes open and including costs, as you say. I mean, it is a series of 3 vaccines, and they're not cheap. Traditionally, most insurances are covering it. If not, you can always inquire about prices at the health department, or even pharmacies now are vaccinating as well. Does your husband's pharmacy do Gardasil yet?
They do.
They do?
Yes.
Okay, well, that's good. That's good.
And they
So-
always call the insurance company to make sure it's going to be covered first.
Oh,
And then they'll be
wonderful.
happy to order it for you.
Oh, good, good. Which has been a great benefit just for the convenience factor. So, yeah, well, great. Well, thanks for joining us, and be sure to like our Facebook page, subscribe to our YouTube channel so you can keep up with all the news we're offering. See you next time.
The preceding advice.
Well, this issue applied in Ecuador is that as part of the National Health Strategy for the Prevention of Uterine Cancer, the Ministry of Public Health, through the Expanded Program of Immunization (PAI), vaccinates the female population of 9, 10, and 11 years. The type of vaccine brought to the country is valent, and the victim of the papillomavirus 16 and 18, which are oncogenic. As mentioned, this immunization is 95% effective. Brigades of professionals already vaccinate minors in educational centers and health centers. So this is what the National Health Strategy of Ecuador says.
Most parents today have heard about the HPV, or human papillomavirus vaccine, but don't know that much about it. And if you don't know much about it, how can you decide if it's right for your son or daughter? Here's what you need to know. HPV is the most common sexually transmitted infection in the U.S. HPV are a group of over 200 related viruses, and while most of them aren't harmful, there are about a dozen so-called high-risk HPVs which can cause cancer. Almost all cases of cervical cancer and about 95% of anal cancers are caused by HPV. The strains that cause genital warts do not cause cancer, but importantly, the strains that are covered by the vaccine are the cancer-causing ones. Most sexually active adults in their 20s have been exposed to HPV, but for most, the infections clear up without causing harm. In other cases, chronic infections of certain types of HPV can cause cancers of the cervix, vulva, vagina, penis, anus, or throat. The Food and Drug Administration has approved 2 HPV vaccines. They are safe and effective. The HPV vaccine protects females and males from HPV diseases. All girls and boys starting at age 11 or 12 should get 2 to 3 doses of the vaccine. If you're older than the recommended age, talk to your doctor about whether or not you should get the vaccine. If you haven't had the vaccine, the best way to prevent infection is to use.
Conclusion. The 9V HPV vaccine prevented infection and disease related to HPV 31, 33, 45, 52, and 58 in a susceptible population and generated an antibody response to HPV 6, 11, 16, and 18 that was non-inferior to that generated by the QHPV vaccine. The 9V HPV vaccine did not prevent infection and disease related to HPV types beyond the 9 types covered by the vaccine, but in Ecuador were somehow delayed in the implement of this new vaccine, so we can cover only 16 and 18 oncogenic types.